Hello, and welcome to This Thing Called Life, a podcast dedicated to sharing stories about acts of giving, kindness, compassion, and humanity. Your host, Andy Johnson, will introduce you to powerful stories about organ, eye, and tissue donation from individuals, families, and healthcare teams whose experiences will inspire you and remind you that while life is hard, unpredictable, and imperfect, it's also beautiful. We're so happy you're here. Now let's join the show.
Welcome, everyone, to This Thing Called Life. I'm your host, Andy Johnson, and I'm so glad that you are here with me today. I have a wonderful guest who is really making an impact in donation, in particular with our children. And so with that, I want to welcome Dr. Monique Goldschmidt to the show. Welcome, Dr.
Thank
Monique Goldschmidt. Dr. Mo is what we will call you, if that's good.
That's great.
Okay.
That's what the kids call me.
That's what the kids, yes. So Dr. Mo is the Associate Director of Cincinnati Children's Intestinal Transplant Program and the attending hepatologist with the liver transplant program. So tell us what that means, because that's a lot.
It is a lot, for sure. So essentially, it is my leadership position is, and my true passion is under the umbrella of intestinal transplant. So I work to really be a leader in that field, while also practicing in the liver transplant realm, which really does overlap quite a bit with intestinal transplant, as some children require both organs at the same time. And honestly, my liver transplant hat is what led me to the love for intestinal transplant. So it's a one big package that I really consider my life purpose, taking care of kids with liver and intestinal transplants.
So in your journey and your education, what led you to land at Cincinnati Children's Hospital?
Cincinnati Children's Hospital is, in my now biased opinion, is the best. It brought me here for sure. I come from Massachusetts, and I came here particularly just for the institution a long time ago, 20 years ago,
Wow.
And I haven't left, all but for a brief hiatus in between 17 and 23. But ultimately, Cincinnati Children's itself, the institution, brought me here, and the people kept me here. And along that journey, I found liver and intestinal transplant, and, the rest is history.
Was there anything in your personal life or just as you grew up that drew you to transplant?
No, I wouldn't say anything in my personal life. I think I've always wanted to be a doctor. I think that just stems from just pure fascination with the human body. And I think what led me to transplant in particular was some time that I spent in the critical care unit as a resident. And I remember it was just fascinating. We were taking care of a child who was quite literally fighting for his life with acute liver failure. And as part of the care team, the multidisciplinary approach and strategy and conversation and collaboration was just absolutely profound and fascinating to me. In addition, of course, the physiology and the science behind it all. It was really the intersection of different disciplines that brought it really, really to the forefront for me and made it unique and basically fostered my career.
In this field of transplantation, I think when we talk about liver and those to me seem so medically complex, right? And then add on to that working with children. What do you think is the difference when you're managing those kind of conditions with pediatrics versus adult patients?
For sure. It's a great question, because I think there's this misconception that kids are just little adults, and that's fundamentally wrong. They're not just little adults. They're their own little human beings, right, with a unique context in which to think about them, right? You have the physiology, of course. It's changing, it's evolving. You have the developmental concept. You have the psychological concept, and then you have the social context as well. And so that requires a unique skill set than dealing with adults who, quite honestly, a lot of what we see and not always, of course, but the lifestyle is what drives some of the adult diseases.
Right.
Whereas with children, it's congenital, it's metabolic, it's genetic, it's immune mediated, and that's a different realm in which you focus in caring for these kids.
Wow.
And then transplant, of course, adds a whole nother layer to that. Kids alone, and then you add the transplant element, which then intersects with all elements of their developing lives, right? Their evolving lives, their identity, their development, all of those challenges. So it's much more nuanced than the adult world.
It has to be, and I've seen this with some of the patients, the transplant recipients who were transplanted as children, and just like their growth and development. It is very nuanced. It's different, and so I would guess that you and your team play a part in trying to help them in their development, because a lot of times their growth is like they're not where they're typically would be with their peers. I mean, there's all of those things, and then I can imagine the psychological impact that would have. What is the care? What does Cincinnati Children's do to manage those parts, those of transplant for the children?
You're describing the developmental
Yes,
piece and
yes.
the psychology. Yeah, that's also a great question. I think the piece of the job there's multiple elements of my job that I love, but one of the most amazing features of the job for me is, again, that multidisciplinary approach to the care of this little human being. So you deeply rooted in the collaboration, of course, with your surgical team, with your psychosocial team. I cannot do this job without them. Your transplant nurse coordinators, who are my eyes and ears, right? The pharmacists who help with just the little interactions with medications that I may not have thought of, or any of those elements. Child life.
Yeah.
They're tremendous folks that help us think about the child as a whole human being and not just an organ.
Not
and
just
that,
treating the disease.
And I'd be remiss if I didn't mention the families, right? Like, I cannot do this job without the families. They are the ones at the bedside 24/7. It is a team effort, not just with the medical providers and the ancillary staff, but with the families, and that is key.
Very much so. I definitely agree with you on that. What would you say, during your time in transplant and in this work, what's been most difficult for you?
Most difficult for me is I struggle with not taking it personally isn't probably the best way to phrase that, but I take these kids home with me, and they truly become my family. And I think, in unique ways, of course, and I think that some would argue that is crossing a boundary with the patients and the families, and I would argue back that I can't do this in the way that they deserve without having that sense of ownership and commitment, and certainly empathy. And yeah, it's an emotionally demanding realm. I think sometimes I not invest because they deserve investment, but I think that I become too emotional, if you will, in who they are as human beings, and that I don't think it doesn't impact my decision making, but maybe it does. I don't think I can change that, and that's just how I practice. And I think that most families value that relationship, but I would say that's probably the most challenging. I think that the other challenge to that comes the sense of failure when you don't have the outcome that you've strived so hard for. That is an impact that does not dissolve. It stays with you.
Right. I can feel the empathy and just compassion that you have for your patients and the families. And I love that you said earlier, like, they are like family, and because you're following them really from when they are little human beings to just watching them mature into adults. And we were talking earlier about Tater Hicks, who I've had the opportunity. Yes, yes,
OG.
he's the OG. And just watching him, he was this little guy, and he, had been through so much, and just continued to fight. And to see him now, like he is, I think he's 18 or 19 years old.
Something like that, yeah.
And I also think of little B, who liver recipient. Her mom donated a portion of her liver. And again, just seeing this maturation, what is that like for you?
It's incomprehensible. It's so absolutely amazing for me to see the roller coaster ride that all of these children face, and then see them crushing it on the roller skating rink like Tater, or playing volleyball, right, at a club sport like B, or I mean, I could just go through a series of different scenarios in which they're thriving, they're causing trouble as teenagers, right?
Doing what they're supposed to be
doing what
doing.
they're supposed to be doing, and causing gray hair for their families, and I love that. It is so fulfilling for me, and that's really why I wake up in the morning. I mean, they really do give me purpose, because I want that for them, right? They deserve a full life, not just survival. They deserve a full childhood, a full life, in the best way that we can give them.
Right.
It is so fulfilling.
So Dr. Mo, walk us through a typical day for you at Cincinnati Children's.
It's a very dynamic question. So that's actually one of the other fun aspects of my job. It's different all the time.
Yeah.
As you kind of alluded to, I start often when they're young, and we carry them through essentially their younger years. And sometimes we have a really hard time of transitioning them, honestly, to an adult facility, because they become part of our family, as I mentioned. So, my days are different day to day, but I would say that the different elements of my day would include inpatient care, which it really encompasses all elements, right? It encompasses kids that are in the pre-transplant phase, who are maybe ill with an illness and need critical attention and care, to the peri-transplant, or the time around an actual transplant, right before the actual surgery, right after the actual surgery, post-transplant complications that come about, because this is never a straightforward ride. It's always a roller coaster. And so I take care of the gamut in that inpatient domain, which is much more intense and acute. And then that's always enjoyable. I love the complexity, and again, that interdisciplinary collaboration. But the outpatient side is also quite fascinating for me, because that's really where they're feeling good, and usually, and you can talk to them about their medicines. Why are you taking this medicine, especially as they evolve into adolescence, right? Which is key. You talk to them about how their nutrition's going. You talk to them about how they're doing. What's their well-being like? How do you feel on a day-to-day basis? It's, again, not just about the medicine.
Right.
So that's really fun to kind of have that bonding time. And any family that sees me in clinic will know that I'm never on time, because I spend quite a bit of time with my families just talking about whatever comes up.
That's great.
Because that's what they deserve,
Yeah.
So inpatient, outpatient care are key. Direct patient care is really my main focus.
Okay.
And when I'm not, face-to-face with a patient, I'm still, synthesizing complex data, whether it's labs that are trickling through, or urgent phone calls that are coming along, or, collaboration with other disciplines or other providers that are also caring for these children. So that's also a key element, and then I think the other piece that's really important, that's tricky in the intestinal transplant population, because we don't do lots and lots of them.
Right.
Which is good.
Right.
Is how can we improve the care of these patients based on our experience, learn from it, and then move the field forward. So the research element is also another hat that I wear within my practice, and that often involves collaborating with other facilities, right? Because we'd only do a handful of intestinal transplants a year, so that's really fun too, knowing that we're really working to make these children's lives better in the future with our knowledge.
So to your point, it really is a rare occurrence for intestinal transplant. And I understand as a whole, and there were 88 done last year, 3 of which were right here at Cincinnati Children's, which is amazing. But along with that, what we've saw in 2025, because you can't have transplant if you don't have families that are willing, right, to donate. And 2025 was a challenging year. That was the first time in many years we saw a decline in number of organ donors. I would think because with the pediatric population and that being, so specialized, that has to have a great impact, not having those organs available. Can you speak to that?
It's hard. And there was many times where I say to families, not necessarily my intestine per se, because it's not necessarily something we do, but liver. I would love to, donate a piece of my liver for some of these families, because organ allocation is becoming increasingly challenging for the pediatric population. And yes, in the liver specific world, we are really working towards live donation, which is hard, and we're doing more of those because of the challenges with deceased donor organ allocation across the country. From an intestinal transplant perspective, I think that 88 may have been pediatric and adult combined.
Oh, okay.
I think.
Okay.
I believe that we've maybe done, in the pediatric world, maybe half to a little less than that, presumably. I'd have to look back at the data. But that's just to say that out of the hundreds of liver alone, isolated liver transplants, liver and intestine or isolated intestinal transplants are far, far, far more rare, which makes it even more challenging to manage. So based on the fact that the experience is limited to certain institutions across the country, another layer to the complication with a lot of these families that have to travel.
Right.
So we start with a balance of risk benefit, right? When we're thinking about listing a lot of these children, but the thing that's really unpredictable and uncertain is how long they're going to wait, particularly for an intestine, and that's challenging. That space of uncertainty for certainly providers, but more so for the families and the children, is that space of uncertainty and the unknown is really uncomfortable, and helping them feel comfort in knowing that we are walking along with them, recognizing that most often they're going to wait upwards of months to sometimes years, and knowing that just because they haven't received a transplant yet doesn't mean we're not going to care for them as a family unit, as a patient, is really important to maintain that trust, and be sure that these patients are in the tip-top shape when that organ does become available.
Right. And many of your patients, they're, like, to your point, when they're waiting, I would believe that they're waiting in the hospital. This is not a situation where they get to go home and get the call. And many of them are coming from out of town because Children's is such an amazing institution.
Yeah. There are actually quite a few that mostly are waiting from home.
Okay.
And that's good.
Yes.
They have lots of data support in both the isolated liver and then the liver intestine literature that supports a better outcome if they're well, relatively speaking, and at home. And so we work, if safe, we work to keep them home as long as possible. But can you imagine being at home for every day, years, in some cases years, and just not knowing, in that space of uncertainty, in the very uncertain world that we live in?
Very much.
It's got to be so overwhelming for them.
Yeah.
And I feel that for them, and I feel that it requires, again, that level of empathy that no matter what phase of transplant you're in, we got you. We got you. But yeah, I feel that.
Wow. So we talked about what you find most challenging. What do you find most rewarding?
That's easy. I could go on for a long time on this, but I'll try to keep it concise. I think the family connection, the teamwork, the bonding, riding the ride with them, and then seeing them thrive, and even, when we, again, don't meet that outcome that we all strive so hard for, just that time with them and walking through some of the darkest days and the hardest chapter of their life and being with them in that space, I think is just, and being invited into that space.
Yes.
Is
it's a privilege.
Is really a privilege. It's
Yeah.
such a profound feeling for me that, no matter the outcome, which we always strive for the best outcome, I find that connection and that trust to be unmeasurable. And I think that's the most fulfilling piece for me. I will always show up for these kids. My kids know that I will show up for these kids. And sometimes they show up for these kids, which is really cool, and teaching them altruism and compassion and empathy. The family, the patient relationships, they're unmatched. And then seeing the patients thrive, it feels like my own children. They feel like I've sent them out to the world and I've done a good job. We've done a good job. And I'm so, so proud of that work.
Yeah. What would one of your patients say about Dr. Mo?
Oh boy. Actually, one of my moms said this to me just recently. I was thinking about this podcast a bit, and I said, if you could describe transplant, and they're in the thick of it right now.
Yeah.
They're still in that first year. They're in the thick of it. So it's a roller coaster ride. And she said, I'm going to need a minute with that one. But ultimately, she said, it feels like you're falling off a cliff with Superwoman pulling you back to safety. She said, there are times in my life where I have fallen to my knees and cried and prayed for an endpoint that she was hoping for. And she said, I haven't done that yet in this journey because of you, because I trust you. That's powerful for me. It's powerful.
That's amazing.
Yeah. And it's not always the words, right? So this same family, the patient they were hosting a 5K walk run, and he was putting together awards, patient made awards for the finalists, first three finalists or finishers, and one of them was a picture of me with a little cape.
Oh.
Yeah. It's just that's the way I get up in the morning.
Superwoman, aka Dr. Mo.
Yeah, those are the types of things that I hear. I'm also a big goofball. I'm not one to just walk in and be, how are you today? I'm one to kind of slide in and maybe squirt a little saline bullet at them, and then they squirt me back. It's quite a bit of fun. So I'm a bit of a goofball. So you might hear that as well from my family.
That's good.
Yeah, quite silly.
Oh, yeah. I love that. I love that for our kids and our families.
I hope they feel it.
Wow. So, Dr. Mo, as we've talked, donation itself has declined. And so I can imagine that living donation would be that much more important, particularly living liver donation, which is something you don't hear as much about as kidney donation through a living donor. Can you talk about what that process would look like for someone who wanted to be a living liver donor?
Sure. So yeah, that's a very important question, especially as we are up against challenges with organ allocation with deceased donors. It comes up from time to time in a pre-transplant evaluation. We often bring it up as well as the providers if the family does not bring it up on their own, as an opportunity to streamline an offer, so to speak, or a transplant for their child or their family member. I think beyond that, we as the pediatric providers kind of shuttle them down a path where they meet with the surgeons and more of the adult providers,
Right.
so that it's separate from the pediatric mindset for the sake of avoiding bias and such. But we raise awareness, we talk about it in our pre-transplant evaluations, and quite honestly, we're now seeing more people step forward as altruistic donors. And I think that we often on the pediatric provider side hear about that from our surgical colleagues who are the ones that are guiding that process a bit more. But I encourage everyone to be obviously an organ donor. I would donate my organs if I could, and I can, but it's a bit more challenging to care for them and donate at the same time. But the bottom line is it's something that we talk about more now to save the lives of our children, because organ allocation is more and more challenging.
So, Dr. Mo, you talked about this is work that, especially working with children, that you can't just turn off once you leave the office, so to speak, and that you take this with you oftentimes, and you take it home because you care so deeply for these families and the patients. What do you do to decompress? What's fun look like for you?
Fun is, for me, and people would consider me masochistic, but I love running all the miles, like long miles. So like my day does not start, when I wake up. It starts at 4 a.m. So I can set the mood for the day, set my mind. I solve problems when I'm running. I find comfort in that space. And so that's fun for me. Long miles with my own mind, and working through whatever struggle, even if it's not work related or work related. I find that very, very calming. And, even though I really don't ever shut off at work, and I always have, whether the children are here or here, they're in my mind. I think that spending time with my kids helps ground me and remind me again of my purpose in that space too. So, fitness, running is really my fun space, my personal time. But being with my family is my kids, my husband, my extended family are what help keep me grounded and decompressed, and remember that, yes, this work is incredibly important and it is your life's work, but you also are a human who needs that space to be and strip down the armor and cry or yell or whatever the scenario may be. Yeah. So family and running.
Do your children have any concept of just how amazing you are with these children and families? Do they know what mom does?
Oh, they definitely know what mom does. They know my patients by name.
Yeah.
I talk about them very often. They'll ask about them. Oh, is Hader in the hospital, for example? Those conversations are frequent, and they frequently ask. And sometimes, in some cases, in community events, they've met some of my families, and so they find that really cool.
Yeah.
I think they wouldn't say that to me. I don't think
No,
they wouldn't say
can't.
I'm cool. But
Yeah. They can't do that.
No.
You don't have any street cred. They
No,
can't give
I
you any
wouldn't.
street cred.
But they see how much I love those babies too.
Yeah.
And they realize that they're important. And so when I go to work and I'm gone for long hours, they understand that I think they understand that I'm doing important work, and they have space for that as they've gone older. So I love that piece, because building and raising compassionate, empathetic children with a strong moral compass is getting harder and harder in this world. And so I want them to see, and I want them to see all the emotions that come with that, that career path,
Yeah. You truly are modeling the way for
so.
them and for others. So
I hope so.
Thank you.
Of course. Thank you.
Is there anything else you'd like to share?
I think that I want folks to know that the ride is a ride. It's a roller coaster, and it's not all uphill. It's not all downhill, but it's a ride, and it's a ride for a lifelong journey. It's not just an end point. While the ride kind of settles out as time passes, it's still a bit of a ride, but there's hope and there's partnership. I think that knowing that they're not alone in this space, if they're right with the right team for them, there's hope, there's life, there's thriving. And to lean into those reminders when things get really tough.
You are indeed a voice of hope for these children and their families. I can see and feel the passion for the work, and the fact that you are all about showing up for them. And I can see that you carry that with you, and that to me is, you couldn't ask for a better doctor.
Thank you.
So
Thank you.
So on behalf of Network for Hope, I want to say thank you for all that you do. Cincinnati Children's has just been such an amazing partner, and we appreciate you, coming on and just sharing this aspect, because I think it's so important for families to understand that this isn't like this linear path. Like you get a transplant and then, poof, it is a roller coaster, but to know that there's a team, there's Dr. Mo, like walking that with them, I think just provides so much hope. So thank you. Thank you for all that you do.
Thank you. This is a wonderful effort, and I will always show up for you as well.
Oh, thank you, Dr. Mo.
You're welcome.
Well, I want to thank everyone for tuning in today. And I also want to thank my guest again, Dr. Mo, and just everything that she is doing for our children, which are our future. And as we close, I want to remind you that there are more than 108,000 people who are waiting for that life-saving gift. And you, too, can be a voice of hope. You can register to be a donor at registerme.org. You can also learn about the opportunity to be a living donor as either a kidney donor or liver donor. That is life-saving and life-changing. We appreciate you listening. I also just want to say, please be kind to yourself and to others, and take care.
Thank you for listening to This Thing Called Life. Subscribe on iTunes or wherever you get your favorite podcast to make sure you get updates on all new episodes. And we would truly appreciate it if you would share, like, or give us a review to help us grow.